Hello and welcome to Medical Dialogues. I am Dr. Nandita Mohan and today we are excited to bring you Dia Dialogues chat show. Modern sulphonylureas have long been an integral part of type 2 diabetes care, offering reliable and effective glucose control. Among these, glyclazide truly stands out, known for its efficacy and safety. For healthcare professionals, understanding what makes glyclazide unique in the 2025 diabetes treatment landscape, among other agents and other SUs, can be insightful for clinical practice. Today, we'll explore why glyclazide remains a cornerstone of modern diabetes care and how it can enhance patient outcomes. Joining us for this discussion on glyclazide revisiting a preferred sulphonylurea in 2025 are Dr. Silima Tarenia and Dr. Shehzad Ruman. Dr. Silima is a consultant endocrinologist at Medica Super Speciality Hospital TMC Kolkata, while Dr. Ruman is a consultant endocrinologist practicing out of Hyderabad. We welcome you to Medical Dialogues. It's a pleasure to have you both on site here with us today.
Thank you so much.
So let's discuss some of the key questions around this episode. So Dr. Silima, my first question to you is, could you share some light on the place of modern SUs in the evolving T2D care continuum in 2025?
Okay, so thank you very much for the question. So basically, if we look at the evolution of type 2 diabetes management in 2025, then I must say we've come a long way, because previously it was all about the glucose-centric approach where they used to only take care of the sugars, but now it has shifted gears to target organ-centric approach and also in the broader sense taking care of the patient's perspective as a whole. So in this background, actually the sulphonylurea should be seen in a different light. That is because sulphonylureas are here for a pretty long time now, and they are actually the cornerstone of management of diabetes. But what is happening is that because of the advent of new molecules like the GLP-1 analogs or the SGLT2 inhibitors, sometimes they are taking over the sulphonylureas, and this is primarily due to the historical fear of hypoglycemia as well as weight gain, which is associated with sulphonylureas. Nevertheless, sulphonylureas have a good glycemic lowering efficacy. They are easily accessible, they are easily available, the pricing is also affordable. So I must say that they still form a common cornerstone of the management. Particularly, we need to keep in mind that the modern sulphonylureas, like the Gliclazide for instance, they are not similar to the older ones. So the metabolic profiling is much more favorable and the chances of hypoglycemia is much more lesser. So every sulphonylurea cannot be placed in a similar position. Now, coming to the HbA1c lowering ability or safety of Gliclazide in particular, there are many trials, even head-to-head, which have shown that Gliclazide can have a robust glycemic lowering efficacy, and at the same time, the safety issues are taken care of, and also the regimen is very simple. So whenever we have a simple, say for instance, a OD dosing, then the adherence as well as the compliance is taken care of well. So what I would like to say is that in this day and age, when the needs of glycemic control is individualized, that it is tailored. So over there, Gliclazide, a modern sulphonylurea definitely has a key role, and it can be used not just in resource constrained settings, but also it can be used along with metformin as early intensification.
Thank you so much, Dr. Silima, for your insightful points. Now moving to you, Dr. Ruman, a recent Indian review paper has reiterated glyclazide as a preferred modern SU in T2D. Now, what are the unique clinical advantages of glyclazide that give it a standout consideration among SUs in T2D care?
Yes, again a wonderful question from your side. I think most of the points have already been covered by Dr. Silima. I'll just give a brief context to first what we are going to talk about. When we talk about sulphonylureas, they have definitely been around for over half a century, as we all know. They are all reliable, they are potent, inexpensive. But the concern has always been our hypoglycemia and weight gain. These two concerns are there with sulphonylureas. The recent Indian review reinforces that clinical experience already shows that Gliclazide provides the benefits, many benefits over other sulphonylureas. As you know, first is the mechanism of how they are binding. Then, unlike older sulphonylureas, Gliclazide has a unique binding profile at the beta cell. It causes glucose-dependent insulin release, meaning there is less risk of hypoglycemia when glucose levels are not good. And its binding is reversible and short-lived, so it doesn't cause prolonged insulin stabilization. And also the clinical advantages are you can structure this part as the lowest hypoglycemia risk among sulphonylureas, suitable even in elderly and renal impairment and dose adjustment. They are weight neutral, and their efficacy is quite good. They get cost reduction of HbA1c by approximately 1 to 1.5% compared to the other agents. Consistent glycemic control even after 5 years of follow-up in the long-term trials, they have given a consistent results. And this cardiovascular and renal safety is also quite good, as we have seen in this advanced trial where more than 11,000 patients have already been enrolled. They use Gliclazide modified release format as the backbone and showed there is no increase in cardiovascular mortality. There's also a reduction in the microvascular complication as well. And this gives us that Gliclazide unique composition as a cardiovascular safe drug, unlike the oral drugs like glibenclamide or glimepiride, where data is less reassuring. And in Indian practice relevance, Gliclazide is very cost-effective, which is crucial for our population. It is available in the modified release format. There is one pop-up, one pill that works for the whole day. That is quite suitable for Indian phenotype. That's it. And as I want to conclude this thing, this bridges the gap between traditional efficacy and modern safety. The sulphonylurea that's evolved with our patients. Thank you so much.
So thank you so much, Dr. Ruman and Dr. Silima, for joining us today and giving us all your valuable insights.
Thank you so much.